Bismillahirrahmanirrahim. Quote of the day. Do good, indeed Allah loves the doers of good. Al-Quran. Assalamu alaikum everyone. My name is Dr. Marina Akhtar, PGR Community Medicine. Today my topic of presentation is dog bite. I am presenting this topic under the kind supervision of my professor Dr. Saira Afzal. Learning outlines. Uh, Dog bite or rabies. Introduction of this topic, epidemiology, transmission and pathogenesis. Stages of rabies and its symptoms, its investigation, its management, its immunization and prevention of rabies, recent updates, and the MCQs. Learning objective. At the end of this presentation, the participants will be able to describe rabies and its spread. They would be able to differentiate between its types, sketch an investigation plan for rabies, demonstrate the management of the rabies patient, comply to the international practice of rabies prophylaxis, and recognize the global importance of its eradication. Dog bite. This picture showing the summary of our whole presentation. We will discuss step by step everything, inshallah. Introduction of the topic. Definition. Dog bite rabies, also known as hydrophobia, is an acute, highly fatal viral disease of central nervous system. It is caused by Lyssa virus type 1 of Rhabdoviridae family. It is primarily a zoonotic disease of warm-blooded animals, particularly carnivores such as dogs, bats, cats, jackals, and wolves. It is transmitted to men usually by bats or licks of the rabid animal. It is only communicable disease of man that is always fatal. Epidemiology. Rabies is an zoonotic and epizootic disease of the worldwide importance. It occurs in more than 150 countries and territories and poses a potential threat to more than 3.3 billion people. Rabies in dogs is the source of 99% of human rabies. It is most common in children aged less than 15 years, and majority of those being males. Globally, more than 15 million people receive rabies prophylaxis each year. Still, human death by rabies is estimated by 59,000 annually, with 95% cases occurring in Asia and Africa. Ecological triad include agent, that is rabies virus. Host include people of the all ages, especially children aged less than 15 years. And environment include area overcrowded with stray dogs and rabid animals. Reservoir and vector include domestic and wild mammals. Rabies in dogs is the source of 99% of the human rabies infection. On average, 40% of rabies cases in human occur in the children under 15 years of age, and the overall economic cost of the dog-mediated rabies is estimated to $8.6 billion. Causative agent. Causative agent is Lyssa virus type 1 and family Rhabdoviridae. Characteristic, it is bullet-shaped neurotropic RNA-containing virus with two types of antigen, a glycoprotein G protein antigen from the virus membrane and an internal nucleoprotein antigen. The glycoprotein seems to be only antigen capable of inducing the formation of virus neutralizing antibodies. There are two types of rabies virus, street virus and fixed virus. Characteristics of street virus are these are freshly isolated, and fixed virus isolated after serial intracerebral passage in the rabbits. And in street virus, they produce negri body, and fixed virus do not produce negri bodies. Street virus affects salivary glands, and fixed virus do not affect salivary gland. Street viruses are pathogenic. Fixed virus are not pathogenic. And incubation period of street virus is 1 to 3 months, 20 to 90 days. And incubation period of fixed virus is 4 to 6 days. Street virus produce disease, and fixed virus used for vaccine. Transmission. Source of infection is saliva of the rabid animals. Mode of transmission it mostly by deep bite, stretches, or direct contact of saliva from the infected animals with human mucosa or fresh skin wound, rarely by inhalation of the virus containing aerosol or via transplantation of infected organ. Human to human transmission by bite is theoretically possible but has never been confirmed. High risk group includes laboratory staff working with the rabies virus, veterinary staff, dog handlers, hunters, field neutralists, and face bigger risk than the general public. Incubation period include 1 to 3 months following exposure, but vary from 7 days to many years. Pathogenesis. It involves 6 stages, 6 steps from the entry of virus into the system to invasion of different structures. First is penetration through skin after animal bite. Second is replication in muscles and connective tissue cells. Third is entry into the peripheral nerves. Fourth is the ascent from spinal cord to brain. And fifth is encephalitis. And sixth is invasion of the muscles, glands, even skin, and the virus may be present in the salivary glands of the infected person. Stages of rabies. There are 5 major stages when the individual develop rabies. First in incubation, 30 to 90 days. It may be variable. And the second stage is prodrome, 2 to 10 days. Third stage is acute neurological encephalitis and paralytic, 2 to 10 days. And fourth is coma, and it may lead to it mostly and in majority of the cases, in 100% cases, may be led to death. Rabies symptoms in the humans. Initial symptoms include the first symptom of rabies may be similar to those of the flu, including general weakness, discomfort, fever, headache, and these symptoms may last for days. Rabies specific symptom. As the disease progresses, the person may experience delirium, abnormal behavior, hallucination, hydrophobia, fear of water, and insomnia. Two major types of rabies. First is the furious or encephalitic rabies, 80%, and second is dumb or paralytic rabies in 20%. Symptoms of paralytic rabies include droop jaw, foaming in the mouth, excessive salivation, facial distortion, uncoordinated movement, difficulty in breathing, progressive paralysis, seizures. And symptoms of furious rabies include extreme aggression, hallucination, hydrophobia, aerophobia, hypersensitivity to light or sound, inability to eat or drink, paralysis, and seizures. Laboratory investigation. Investigating a rabies patient involve following tests. Direct fluorescent antibody test. It is the gold standard test. Tissue from at least 2 locations in the brain, preferably the brain stem and cerebellum, are taken. And second is CSF analysis, saliva, serum, and urine test. Third is skin biopsy. Fourth is corneal smear. Fifth is MRI brain. And sixth is EEG. Management of rabies. Case management of rabies include the following points. Number one, general management. Second, wound care. Number three, immunization. And number four is dog observation. General management include isolation in the quiet room away from the external stimuli such as bright light, noise, or cold or draughts. Second, use of sedatives and analgesics. And third is antispasmodics, and the use of and the excessive hydration and diuresis, and respiratory and cardiac support. Wound care include flushing and washing the wound, scratches and adjoining areas with plenty of water and soap under a running tap for at least 15 minutes. Irrigation with virucidal agents, ether alcohol, tincture, or 0.01% aqueous solution of iodine, or povidone iodine. Switching if necessary, but only after 24 to 48 hours, applying minimum possible stitches. Use of antibodies and anti-tetanus measures. Immunization. Combined administration of the single dose of rabies immunoglobulins, passive immunity, and the course of vaccine, active immunity. Dog observation. Try to detain the dog for 10 days observation if possible. Observe its behavior and see if it remains healthy for observed period. And if the dog is still alive, then after observation, it was not shedding rabies virus at the time the bite occurred. This picture showing 4 steps. Remember to stay calm. Remember the characteristic of the biting animals. Number second is to wash the wound. Number three is observe the animal. Number three is seek medical care, and number four is observe the animal. Rabies vaccine. Rabies vaccine are of following two types: cell culture vaccine (CCV) and second is embryonated egg-based vaccine (EEV). Both vaccines are free of any preservatives with shelf life less than 3 years, provided they are stored at 2 degree to 8 degree centigrade and protected from sunlight. After preparation, the vaccine should be used within 4 to 8 hours if kept at the correct temperature. Vaccine schedule include before exposure. First dose is day 1, second dose is day 7, third dose is 21st or 28th day. After exposure in unvaccinated people, it first dose immediately, and the second dose third day, third dose 7 day, and then 14 day and 28 day. But in fully vaccinated patient, first dose immediately after the exposure and second dose is on third day. And poor immune system in the people with poor immune system, first dose immediately post exposures, and then next dose is third day, 7th day, 14th day, and 28th day. Rabies immunoglobulins. There are two types of rabies immunoglobulins: human rabies immunoglobulins, 2 international unit per kg body weight, and equine rabies immunoglobulins, 40 international unit body weight. Rabies immunoglobulins for passive immunity is administered only once, preferably at or as soon as possible after the initiation of post-exposure vaccination. Not indicated in pre and re-exposure cases. Immunoglobulin is injected into or around the wound site and remaining, if any, is injected IM away from the site of vaccination. This picture showing the rabies vaccine and rabies immunoglobulin. Prevention of rabies. Prevention include general preventive measures, vaccinating dogs, vaccinating people, awareness campaigns. General preventive measures include nursing personnel attending rabid patients should be warned against the possible risk of contamination. And second, they should wear face mask, gloves, goggles, apron, as virus may present in the patient body fluid. And third is person having bruises, cuts, or open wounds should not be entrusted to look after the such patient. Vaccinating dogs. 80 to 90% of the dog population is accessible for vaccination. Vaccinating dog through mass vaccination program is the most effective strategy for preventing rabies because it stops the transmission at its source. All the dogs should receive primary immunization at the age of 3 to 4 months, and the booster dose should be given at regular intervals. Killing free roaming dog is not effective in controlling rabies. Vaccinating people. Exposure prophylaxis by the use of a vaccine may be considered under 3 heads: post-exposure prophylaxis, pre-exposure prophylaxis, post-exposure treatment of the person who have been vaccinated previously. Post-exposure prophylaxis. Categories of contact with suspect rabid animals. Category 1 include touching or feeding animals, licks on contact skin. A post-exposure prophylaxis measures. In category 1, none. In category 2, where nibbing of the uncovered skin, minor scratches or abrasion without bleeding. And Measures include immediate vaccination and local treatment of the wound. Category 3, single or multiple transdermal bites or scratches, licks on the broken skin, contamination of the mucous membrane with saliva from licks, contacts with bats, immediate vaccination and administration of the rabies immunoglobulins, local treatment of the wound. Intramuscular administration, a single dose of 0.5 ml or 1 ml depending upon the type of vaccine into deltoid or anterolateral aspect of the thigh. ASN regime include 5 such doses, 1 dose on day 1, on day 0, 3, 7, 14, and 28. And ZARB regime include 4 doses, 2 doses on day 0, followed by 1 dose on day 7 and 21. Intradermal administration, a single dose of 0.1 ml per side at 2 sites into deltoid or anterolateral aspect of the thigh. 8 doses in total, 2 doses on day 0, 3, 7, and 28. On intradermal dose equal, so 1/5 of the intramuscular dose, as 0.1 ml is intradermal and 0.5 is intramuscular. Pre-exposure prophylaxis. Pre-exposure prophylaxis is for individual but mostly recommended in those who are continual, frequent, and increased risk of exposure to the rabies virus. These includes laboratory workers dealing with the rabies virus, veterinary staff, and animal handlers, travelers with outdoor exposure, and children living in rural high-risk areas. 0.5 ml or 1 ml of intramuscular administration or 0.1 ml of the intradermal administration of the vaccine, 3 doses on day 0, 7, and 21 or 28 day. Booster dose are administered as the extra precautions only for the people who are continual high risk of exposure. If available, antibody monitoring is preferred to the booster administration. This is done every 6 months. A booster dose is given only if the rabies virus neutralizing antibody titer fall to less than 0.5 international unit per ml. Low risk individual having serological monitoring every 2 years. Rabies post-exposure treatment of the person who have been vaccinated previously. Rabies virus exposed individual documented previously completed vaccination have 2 options. One, intramuscular or intradermal dose at day 0 and 3. 4 intradermal doses equally distributed over left and right deltoid and thigh at day 0. These regime apply to the people vaccinated against rabies who have demonstrated rabies virus neutralizing antibody titer of less than 0.5 international unit per ml. Rabies immunoglobulins not indicated in these cases. Re-exposure rabies treatment. This table showing the re-exposure a vaccination for in a re-exposure cases for less than 3 days. If schedule is complete, vaccination doses are not recommended. If incomplete, indicate vaccine doses needed to complete the schedule, and so on, showing this in this table. Contraindication to the vaccine. For pre-exposure prophylaxis, previous severe reaction to any component of the vaccine. For post-exposure prophylaxis, no contraindication as severely fatal disease. And no contraindication for infancy, pregnancy, immunocompromised patient, or including children with HIV or AIDS. Awareness campaign. Public education for both children and adults on dog behavior and its bite prevention, and what to do if bitten or scratched by a potentially rabid animal. Responsible pet ownership are essential extension of the rabies vaccine programs. How to avoid dog bite. Don't disturb the dog that is sleeping, eating, feeding its puppies. Do not approach an angry dog, a scared a dog without its owner. Do not hurt them. Do not pull their ears or tail, and do not ride or step on the dogs. Rabies A sign in the dog. Some of the most notable signs of the rabies in the dog include excessive salivation, lethargy, changes in behavior, aggression, hallucinations, sensitivity to stimuli, paralysis or paresis, and abnormal vocalization. World Rabies Day. World Rabies Day is on 28th of September. WHO key fact include rabies is the serious public health problem over 150 countries and territories, mainly in the Asia and Africa. It is viral, zoonotic, neglected tropical disease that causes tens of the thousands of deaths annually, with 40% being children under year 15. Dog bites and scratches cause 99% of the human rabies cases. Once the virus infects the CNS and clinical system, impairs rabies is 100% fatal. However, rabies deaths are preventable with prompt post-exposure prophylaxis. Pre-exposure Post-exposure prophylaxis consists of thorough wound washing, administration of the course of the human rabies vaccine, uh, and when indicated, rabies immunoglobulins. If a person is bitten or scratched by potentially rabid animals, they should immediately and always seek post-exposure care. WHO and its global partners aim to end human deaths from the dog-mediated rabies through a comprehensive One Health approach, promoting the mass dog vaccination, ensuring the access to post-exposure vaccine, health worker training, and improve surveillance and bite prevention through community awareness. A WHO campaign against rabies. 99% human cases are caused by dog bites, one death every 9 minutes worldwide, 4 out of 10 deaths are of children, and zero deaths by 2030. And 100% vaccine is a preventable disease, vaccine to save lives, vaccine human to save life, and vaccine dogs to stop transmission. No bite, no rabies. Learn how to interact with dogs. Now coming to recent updates. Our first article is incidence of the dog bite injuries and its associated factors in Punjab province of the Pakistan. Dog bite are the major cause of transmission of rabies virus in the humans. Pakistan ranks fifth among the most rabies affected countries in the world. District-wide data about the reported cases of the dog bite from 2016 to 2019 were used to map annual crude incidents per 1 lakh of the population. There was an obvious septal variation in incidence of the dog bite, but there was no evidence of septal autocorrelation. The risk of the dog bite attacks were relatively higher in the district with low human population density per square kilometer, poor literacy rates, poor rural population, and lower median nighttime lights. Second article, a debate on the elimination of the dog-mediated human rabies in developing country by 2030. Rabies is the vaccine preventable viral disease that affects over 150 countries and territories of the world. It is responsible for approximately 59,000 annual deaths. Rabies is still persistent public health concern in the low and the middle income countries. It is believed that interplay of the sustainable investment strategies and rabies education through developed countries should positively affect the cooperation of the culturally diverse regions and could help garner coordinated action from the different areas affected by the dog-mediated rabies. Breaking the rabies transmission cycle requires a comprehensive approach that includes increased vaccination efforts, improved surveillance, control of the wildlife population, and the public education and the awareness. Gavi to boost access to the life-saving human rabies vaccine in over 50 countries. Gavi, WHO, UAR. Gavi is in Gavi, the vaccine alliance is in collaboration with the partner is announcing the support for the human rabies vaccine for the post-exposure prophylaxis as a part of the routine immunization. Eligible countries are receiving guidance on how to assess these vaccine under Gavi uh, um, co co-financing policy. The first round of application will be have been accepted in July 2024. The development of the complement ongoing global efforts of Zero by 30 campaigns led to United Against Rabies partner. It is more than in more than 150 countries where dog rabies remain the serious public health problem, stock of the human rabies vaccine in the public health system are often extremely limited, especially in the marginalized communities where the human rabies vaccine is available through private facilities. The cost of PEP can impose a catastrophic financial burden on the families and communities. Gavi aim this program is to contribute the global rabies effort and save lives by helping countries ensure that human rabies vaccine are available to any more who need them, and that vulnerable and marginalized communities have equal access to these essential medicines, said Aurelia uh, Goin, the chief program officer at Gavi, the Vaccine Alliance. Now coming to our MCQ session. MCQ number 1 is a 29-year-old pregnant woman present with a dog bite on her ankle. The dog was a stray and its vaccination status is unknown. She is concerned about the safety of the rabies vaccine during the pregnancy. What should you advise? Option A, rabies vaccination is contraindicated in pregnancy. Option B, delay vaccination until delivery. Option C, start full post-exposure prophylaxis immediately as rabies vaccine is safe in pregnancy. Option D, give only rabies immunoglobulins, no vaccine is needed. Option A, observe for the symptoms and treat only if she develops fever or neurological signs.
I guess the option D is.
No, option C is the right answer, as this vaccine is safe in pregnancy. A 40-year-old man is brought to the emergency department after being bitten by a rabid dog. The wound is large and deep, involving the extensive tissue damage. Rabies immunoglobulins is unavailable in the hospital. What is the most alternative? Option A, give only rabies vaccine and wait for the immunoglobulin availability. Option B, use a double dose of rabies vaccine instead of the immunoglobulin. Option C, start rabies vaccine immediately and arrange immunoglobulin as soon as possible. Option D, do not give rabies vaccine until immunoglobulins is available. Option E, prescribe antibiotics and delay rabies prophylaxis. Answer is option C. Start rabies vaccine immediately and arrange immunoglobulin as soon as possible. A 22-year-old veterinary student is bitten on the forearm while treating a dog with a clinic. The wound is superficial and dog is fully vaccinated. The student had received a pre-exposure rabies vaccine series 6 months ago. What should be done? Option A, start the full rabies post-exposure prophylaxis vaccine plus immunoglobulins. Option B, only administer a booster dose of rabies vaccine. Option C is observe the dog and vaccine only if become symptomatic. Option D is give a tetanus booster but no rabies vaccine is needed. Option E is no treatment is required. 3
B.
is option B. A 50-year-old farmer present on the hospital with a dog bite sustained 3 days ago. The wound was not washed properly at that time. He had received a tetanus vaccine in the past 5 years, but no rabies vaccination. The dog was stray and disappeared after biting him. What is the best course of action? Clean wound and prescribe oral antibiotics. Start the full rabies post-exposure prophylaxis, including rabies immunoglobulins. Option C, observe the wound and vaccinate only if the signs of infection appear. Option D is administer a tetanus booster only. Option 2, don't do nothing as rabies symptoms would have already appeared.
B.
Yes, B is the right answer. MCQ number 5 is a 10-year-old boy is brought to the clinic after being bitten on the leg by a stray dog. Uh, the wound is deep with visible muscle exposure. What is the first step in the management? Option A, switching the wound immediately. Option B, irrigation of the wound with soap and water for at least 15 minutes. Option C, the administration of the tetanus Booster only. Option D is immediate antibiotic therapy. Option E, applying a tight bandage to stop bleeding. Uh,
B.
yes, answer is option B. A man received his full post-exposure rabies vaccine 3 years ago after a dog bite. Today he is bitten again by a stray dog on his leg. What is the appropriate vaccination strategy? Option A: no vaccination is needed. Option B: give a full 5 dose rabies vaccine. Option C: give only 2 doses booster dose on day 0 and 3. And Option D is only clean the wound and give antibiotics. Option E, the rabies immunoglobulins along with the full vaccination. Answer is option C,
C.
give only 2 booster doses on 0 and 3. A pediatrician with a rural hospital is conducting a study on the dog bite victims based on the global epidemiological data. Which age group is most commonly affected by the dog bite? Option A: infants 0 to 1 year, children 5 to 9 years, adolescent 10 to 19 year, adults 20 to 40 years, and elderly greater than 60 years. This is option B, children from 5 to 9 year. This is the most best option. Otherwise, less than 15-year children are mostly victims of rabies, of dog bites. A 7-year-old boy is brought to the emergency department after being bitten by a stray dog while playing in the street. The wound is located on his face and is actively bleeding. What is the most concerning risk in this case? Option A: bacterial infection. Option B: tetanus. Option C: rabies transmission. Option D: allergic reaction. Option E: psychological trauma. Answer is option C: rabies transmission. MCQ number 9 is a 30-year-old male present with hydrophobia, fever, confusion 3 months after the dog bite. He did not receive any post-exposure prophylaxis. What is the most likely diagnosis? Option A: tetanus. Option B: rabies encephalitis. Option C is meningitis. Option D: brain abscess. Option E: acute viral fever. Answer
B.
is option B, rabies encephalitis. MCQ number 10 is a public health official in Pakistan is assessing the burden of the rabies cases in the country. What is the percentage of rabies cases in Pakistan are attributed to dog bite? Option A: 10 to 20%. Option B: 30 to 40%. Option C: 50 to 60%. Option D: 80 to 90%. Option E: 90 to 100%. The answer is option D: 80 to 90%. This is the key of my MCQs. This is the YouTube channel where all presentations are YouTube link of the our channel where all presentations are uploaded. Kindly like and subscribe, and thank you.